Hello, Professor Bell and class. My name is Lauren Bird, and my topic for discussion is the security of electronic health records and the need for continuous quality improvement. In just over a decade, electronic health records, or EHRs, have gone from a curiosity that could potentially help patients receive adequate and faster service to a vital part of the healthcare industry. The EHR was originally meant to only include the individual patient records, but now also encompasses pharmacies, health and insurance exchanges, and even allows patients to access their own information in a way not allowed in the past, BPU Wildcat 2020. All of this growth has led to the need for a continuous quality improvement, or CQI program, to be set in place in regard to the security of the ever-expanding system, BPU Wildcat 2020. In order to create a running and adaptable CQI system focused on the security of the EHR, the breach to records, root causes of the insecurities, and programs to address the breakdown of the system need to be explored. The need for a CQI program for the security of the EHR system is further exemplified when you examine the current problems within that system. This can be done in many ways, but according to Goetsch and Davis, 2016, the best way to go about setting up the CQI system for EHRs is to utilize the Plan, Do, Check, Adjust cycle, PDCA, as well as utilizing the scientific approach to collect meaningful data in order to identify the problem. When the current information regarding the security of the EHR system is tracked, a negative trend begins to take shape. In the past 3 years, 93% of all healthcare facilities have suffered a breach in the security of the EHR system, with 57% of these same facilities suffering 5 or more compromises in the same 3-year time frame, BPU Wildcat 2020. This trend can be further broken down. It shows that 88% of all healthcare facilities have been attacked by malware at some point since the setup of their EHR system, BPU Wildcat 2020. In addition to malware, 96% of all ransomware attacks target healthcare facilities such as hospitals and primary care offices, BPU Wildcat 2020. On average, it takes healthcare agencies 236 days to identify a breach in their EHR system, BPU Wildcat 2020. Two specific examples on the problems associated with the lack of security associated with the EHR systems and prove the need for a robust security CQI program. On May 1st, 2021, Scripps Health in California suffered a major breach of their EHR system, Landi 2021. This breach of Scripps Health led to 4 of their health facilities putting themselves on bypass for emergent care of patients suffering from heart attacks and strokes, Landi 2021. Bypass is when a hospital or healthcare facility cannot offer emergency care to patients with time-sensitive needs. The healthcare facilities were also forced to cancel and reschedule most patient visits for the day of the cyber attack, Landi 2021. This had a direct impact on patient care and can lead to worse health outcomes, not to mention the thousands of patients that have had their personal data exposed and possibly stolen, Landi 2021. A second event took place in January 2020 involving the LabCorp testing centers, one of the largest laboratories in the United States, BPU Wildcat 2020. In the LabCorp event, at launch of the new EHR system, the security was improperly implemented and led to the failure, causing tens of thousands of records to not be properly encrypted, BPU Wildcat 2020. This allowed anyone in the public to view the confidential documentation, BPU Wildcat 2020. The next step to building a CQI system is to identify the root cause, Goetsch and Davis 2016. The Ponemon Institute conducted a survey that looked to identify the root causes of the data breaches within the EHR systems, BPU Wildcat 2020. They found that 55% of the breaches came in through the medical records EHR system itself, with the next highest being 46% of the leaks coming from the billing and insurance departments that have auxiliary access to the EHR system, BPU Wildcat 2020. These departmental breaches are further broken down and show that 96% of the compromises came in through employees losing devices or falling prey to phishing scams, BPU Wildcat 2020. Healthcare management was also interviewed. Management noted that their biggest concern in regard to security is employee negligence at 70%, with the next biggest worry coming from a direct or indirect cyber attack of the EHR system at 40%, BPU Wildcat 2020. While other root causes do exist in the EHR program, the biggest cause of breaches is due to employees. The next step in the CQI system is to implement a planned solution, Goach and Davis 2016. The video created by BPU Wildcat 2020 notes that training employees about how they fit into the security CQI program of the EHR system and how to properly protect their devices showed the biggest gains in maintaining the security of the system. This was done through education on password security and encrypting the data, which lowered the risk for breaches by 51%. This is echoed by Rodriguez 2013, showing that when setting up the access, only necessary authorized individuals should have access, and stresses the need for strong passwords. Goach and Davis 2016 go on to further explain that in order to complete the security CQI, there is a need to determine the effectiveness of the implemented changes and plan for the continual improvement. Rodriguez 2013 notes this can be completed through audits, while the video by BPU Wildcat 2020 echoes that constant vigilance is required to assure the security of the EHR system. As EHRs begin moving to the cloud and the access to EHRs is coupled with the ever-growing access points of the EHR system, the need for a security CQI becomes more critical. Rodriguez 2013. Without this system being in place, not only will the breaches continue to increase in number, but the lives and cost of these leaks will become more detrimental to patients. BPU Wildcat 2020.